We want to try to clarify the public health messaging about COVID-19 vaccines. For months, we have repeated the advice to take the first vaccine you are offered. Well, then the National Advisory Committee on Immunization, a group of physicians and vaccine experts, muddled that message. It says the Pfizer and Moderna vaccines, both of them mRNA vaccines, are preferred over AstraZeneca and Johnson & Johnson. Well, here are some undisputed facts. First, every piece of evidence we have now points to vaccines as the way out of the pandemic. 4 vaccines are approved for use here in Canada. All will prevent you from getting seriously ill or dying from COVID-19. Millions of doses have been given to people in countries around the world. The Oxford AstraZeneca vaccine does carry an exceedingly rare risk of developing blood clots, believed to be roughly 1 in 100,000. But the risk of developing blood clots from COVID-19 is much higher than that. Today, Prime Minister Justin Trudeau, who himself got the AstraZeneca shot, didn't criticize the experts at NACI, but he did try to get the messaging back on track.
The impact of catching COVID are far greater and far deadlier, as we've seen across the country, than potential side effects. The reality is, the way we get through this pandemic is to get vaccinated with whatever vaccine is offered to us as quickly as possible.
That message is especially important if you live in part of the country where COVID-19 is spreading through the community. In the middle of a third wave, vaccine shopping is a luxury those at high risk of COVID cannot afford. David Aiken has our top story tonight.
Looking forward to that. When it was their turn to get the jab, the Prime Minister and his wife got doses of the AstraZeneca vaccine. They joined 1.7 million Canadians who've had at least one dose of AstraZeneca.
On a personal level, I am extremely pleased that I got the AstraZeneca vaccine a number of weeks ago.
Like the Trudeaus, Edmonton mom Shauna Pilgrim has also received a first dose of AstraZeneca.
My sister works in public health and she has been overrun this whole time. So I thought, okay, I'm going to do my part to lessen the load for someone like her.
But with the National Advisory Committee on Immunization repeating their recommendation that Pfizer and Moderna, the 2 mRNA vaccines, are preferred over AstraZeneca, well, Pilgrim is wondering what to make of that.
To hear that, I'm thinking, well, is AstraZeneca bad now? Like, should I have waited? So it was just very confusing to hear that today.
The message from Canada's Chief Public Health Officer, don't be confused. That was the right decision.
The AstraZeneca vaccine has really saved lives, and that the vaccine has done what it was designed to do.
Now, millions more Pfizer and Moderna vaccines are flooding into the country, and so the situation in specific regions may influence advice from local officials.
I still encourage everybody to receive the vaccine that is available to you first. And I can say that my family members received the AstraZeneca vaccine.
All our vaccines are good vaccines. The reality is that the mRNA vaccines are better vaccines.
But the bottom line from the PM?
The most important thing is to get vaccinated with the first vaccine offered to you. It is how we get through this. Every vaccine for use in Canada has been judged safe and effective by Health Canada.
Now, most AstraZeneca vaccination programs in the country are running low on supply, but the federal government today says they expect as many as 2 million more doses of AstraZeneca to be in the country by June. Donna?
Okay, David Aiken in Ottawa, thank you.